So just want to do a territory acknowledgement. Um, we acknowledge we are gathered on Treaty 1 territory, the homeland of the Red River Métis and the ancestral lands of the Anishinaabe, Dakota Oyate, and Denizali and Inukjuak nations, and that northern Manitoba includes lands ancestral to the Inuit. We acknowledge the harms and mistakes of the past and that we are dedicated to listening and respecting traditional teachings regarding oral health. Our research team and Healthy Smile Happy Child initiative are committed to building relationships with First Nations, Métis, and Inuit communities to incorporate Indigenous knowledge in our research and health promotion efforts. By addressing the oral health disparities faced by Indigenous children, we strive to continue advocating for the oral health of all Indigenous children, their families, their communities, and fostering trust through transparency and respect. So let's get started. So just kind of got the presentation laid out by just facts. So if you have a question about something, maybe you can remember the page number or the fact and we can go back to it. So fluoride occurs naturally in water, though generally not at high enough levels to benefit teeth. So again, it exists naturally in pretty much all water supplies. It is a mineral that exists naturally in all water supplies, including lakes, rivers, and groundwater. And main sources of exposure to the general population to fluoride are water, food and beverages, and dental products. So you can see here, there's a couple of photos here from Lake of the Woods. One is sort of near the shoreline where you've got some marshy area and out on the lake with some stormy looking clouds. So yeah, there's fluoride in those waters too, just at varying levels. So fluorine is a chemical element with the symbol F and atomic number 9. It is a member of the halogen family. It's pretty volatile by itself, but as fluoride, as a negative ion of the element fluorine, it's a natural mineral and it's very quite stable. So fluoride is created when salts from the element fluorine combine with minerals in soil or rocks. And so it helps, we consider it a great preventative for tooth decay by strengthening enamel and inhibiting bacterial activity that leads to acid production. So again, we've said it many times already, it's a mineral, and in a minute amount, fluoride in drinking water helps to strengthen teeth. So again, it works in 2 ways, topically, and is also ingested, so incorporated into the developing enamel, making enamel harder and more resistant to decay. So again, fluoride is one of several examples of everyday products, similarly that are fortified to improve our health. Iodine is added to salt, folic acid is added to bread and cereals, and vitamin D is added to milk. So again, we consider it an important nutrient for healthy teeth. That picture there is of rock, the fluoride salt rock. So I've heard that people have some of that and you can get jewelry made out of it if you're so inclined, sorry. So again, just also mention that foods that are fortified for your health. So iodine is added to salt, vitamin D in milk, vitamin B3 and B2 in bread, omega-3 and 6 in eggs, and folic acid is added in flour. So you find a lot of that in pasta, for example. So another fact or a factoid, community water fluoridation is the most cost-effective way to protect oral health and advance health equity. So we consider it the least expensive way to provide everyone in the same community with a proven form of cavity prevention. Water fluoridation is the controlled addition, or it might be the reduction as well, of fluoride in a community water supply, and we aim for 0.7 parts per million. So if communities are above 1.5 parts per million, which is the maximum acceptable concentration, they may have to mitigate in their water supply how they're going to reduce that. And we have used water fluoridation in Canada to prevent tooth decay since 1945. So that's a really long time. Okay, so fluoridation actually saves money by preventing tooth decay. Evidence shows that across the US, people in fluoridated communities save an average of $32.19 per person, I guess that's US dollars, in 2013 US dollars, every year in reduced need for dental treatment compared to those without fluoridation. I've also seen some other references that have indicated anywhere from, uh, you know, $5.49 to $93 per dollar invested. So it does save, individuals money for sure. So another question that comes up is about the IQ studies. So many IQ related studies were poorly designed and gathered unreliable data or tested fluoride levels that far exceeded those in the USA or Canada. So most of the studies that cite a link fluoride or cite a link or link fluoride to a lower IQ scores in children were conducted in other parts of the country, of the world, sorry, such as China, India, or Iran. In many of these countries, the natural fluoride levels in water are many times level used to fluoridate drinking water in Canada, the US. So in parts of those other parts of the world, you're dealing with parts per million that are 8 to 10, 12 or more parts per million in their water sources with levels that we just don't even see here in Canada or the US. So just a little bit more information about some of those studies. British researchers who evaluated these studies from China and other countries found basic errors. These researchers pointed out that the lower IQs could be traced to other factors such as arsenic exposure, the burning of high fluoride coal inside homes, and taking in or eating contaminated grain. And again, many experts in psychology and neurology have questioned the design and methods of the Canadian fluoride IQ study in 2019 that is most frequently cited by opponents of fluoridation. These experts questioned the validity of the study's conclusion, given that a number of potential confounding factors, such as a mother's IQ scores, were not available or taken into account. Also, the study's authors did not explain why there was no link between IQ scores and whether children were born and raised in a fluoridated city. So, fluoridation is a public health measure, a cost-effective community investment that benefits everyone regardless of age. So, that fluoride floating around in somebody's drinking water doesn't really know, you know, where you live or what kind of job you have or what kind of car you drive. It just knows that there's some enamel that needs some help and is incorporated into the enamel. Again, so it isn't, fluoride exists naturally in water supplies. So it isn't a question of choosing, but a question of assuring that people receive the right amount to prevent tooth decay. And again, the aim is 0.7 parts per million. We consider it equitable because the entire population benefits regardless of individual financial resources. And, public health decisions are made based on what benefits the whole community and on balanced scientific evidence. We're just trying to give basically the most bang for your public health dollars and what's going to help the populations that need it the most. Okay, so high fluoride concentrations can lead to dental fluorosis. Nearly all dental fluorosis in Canada is mild. Um, this condition is not painful. It does not affect the health or function of the teeth. So mild dental fluorosis, again, is faint. white spots or flecks on the enamel of teeth, which occurs during the development years up to age 8. So after that, it's not going to show up. If children are exposed to too much fluoride, the Canadian Health Measures Survey from 2007 to 9 found that so few Canadian children aged 6 to 12 years old have moderate or severe dental fluorosis that even combining the categories, the prevalence is too low to allow reporting. So really, it's just very, very negligible, the mild dental fluorosis. To most trained eyes, it might be a little bit visible, but to the untrained eye, it wouldn't be really visible, and it would just generally not be of that much of an aesthetic concern. In 2015, the US Public Health Service updated its recommended fluoridation to 0.7 parts per million. I believe they were over at 1.5 parts per million, and their MAC was the maximum acceptable concentration was 2 to 4 parts per million, but they've dropped that as well to reduce the likelihood of fluorosis while continue to protect teeth from decay. So getting enough fluoride in childhood is critical to strengthening teeth over an entire lifetime. So babies and children need fluoride to strengthen their growing teeth. Fluoridated water benefits developing teeth even before they're fully visible in mouth. The use of fluoridated water to prevent and control cavities is both effective and safe in younger populations. We do know that sometimes the benefit is less, just given the fact that there is a little bit more exposure to fluoride just from what you're eating and from toothpaste, but it still has a benefit. Children who drink fluoridated water as their teeth form will have stronger teeth that resist decay better over their lifetime. A 2010 study confirmed that the fluoridated water consumed as a young child makes the loss of teeth due to decay less likely 40 or 50 years later. So it will set you up for a better long-term outcome for how your teeth are as you age and grow into adulthood. So we know that children who swallow toothpaste are at an increased risk of mild fluorosis. Again, mild fluorosis is the fluorosis where you can barely see it, might have the odd little white fleck or white spot on your usually the upper anterior adult teeth as they come in. But we recommend fluoride toothpaste is recommended by, the Canadian Dental Association, American Academy of Pediatrics, the American Academy of Pediatric Dentistry, and the ADA as well for babies and toddlers as soon as the first teeth come in. Again, it talks about dental fluorosis, and that's not harmful to teeth. It's just can be an aesthetic concern. So that's why it's important to follow the guidelines on the proper amount of toothpaste to use and to supervise children when they brush and to, teach them to spit rather than swallow the excess. You don't leave your, toothpaste sitting around. As we know, young children will get into everything, so keep it out of the way. And the warning label on toothpaste reflects the fact that it contains a higher concentration, roughly 1,500 times as much fluoride per milligram than fluoridated water. So, drinking some fluoridated water is just not going to get you this mild fluorosis. It's going to be getting a mouthful of toothpaste, which would also make your tummy sick as well. So again, another reason to keep it out of the way. So again, this study just talks about this is fluoridated water is safe for babies and young children. So just some information from the American Academy of Pediatrics and NASM, the National Academies of Sciences, Engineering, and Medicine from 2020 and 2021. That the report raised concerns about fluoride's effects on the cognitive ability of preschool age children. NASM found that this report fell short of clear and convincing, providing a clear and convincing argument Several studies have explored the link between fluoride and cognitive effects, but the findings are not consistent. Uh, Studies conducted in Canada and Mexico have reported associations between the two, but studies from New Zealand and Sweden have found no such link. And a study from Spain actually found a link between fluoride and a positive effect on boys' cognitive performance. I'm not going to comment about that. And the ADA states that doctors can suggest the continued use of powdered or liquid, and I guess dentists can suggest the continued use of powdered or liquid concentrate infant formulas reconstituted with optimally fluoridated drinking water. Parents should discuss any questions they may have with their health care provider. So, if you have families or parents, or maybe people in some of the programs that you run have questions, they can, have a chat with their physician or with their dentist as well too. Just what to do. And I have some more slides coming up about that as well. So many health and medical organizations and dental organizations agree fluoridated water is both safe and effective, and leading health and medical authorities support water fluoridation as safe. Health Canada and the CDC support panels of experts from different health and scientific fields have provided strong evidence that water fluoridation is safe and effective. More than, almost 7,000 studies or reports had been published or have been published on the subject of fluoridation, making this one of the most researched topics in public health. So there's a lot of discussion going on about it. There's a lot of reports that have been done, and the governing bodies that look after your dental oral health professionals as well, agree that it is water fluoridation as safe. So dozens of studies, and this is just another building up on that as well. Dozens of studies and 75 plus years of experience have consistently shown that fluoridation reduces dental decay. So a CDC recognizes it as one of the 10 great public health achievements of the 20th century. Research has shown that tooth decay has increased significantly in cities that cease fluoridation. A 2021 study here in Canada showed that before Calgary ceased or stopped fluoridation, the tooth decay rate of its second graders was lower than the rate in Edmonton, a city situated 100 miles to the north. But after fluoridation ended, the study revealed that Calgary's rate started to increase significantly, while surpassing the rate in Edmonton where the fluoridation continued. Another 2022 study compared dental health in two Alaskan cities, Anchorage and Juneau. 5 years after Juneau ceased fluoridation, the cost of Medicaid treatments for children had jumped by 47%. By contrast, these costs only rose by 5% in fluoridated Anchorage. So that's an American study. Adults, all populations benefit too, but adults included. A 2007 review of studies found that fluoride prevents caries or tooth decay among adults of all ages, and that fluoridated water prevents decay by generally about 27%. Different studies will, float that number. I've seen anywhere from 25% or 20 to 40%. Depending, the 40% would be higher, and a higher number in sort of disadvantaged populations, or newcomer populations, immigrant populations, seniors, or people of low economic status. Next. So this is a slide that's is part of our State of Community Water Fluoridation Across Canada document that we put together with the Office of the Chief Dental Officer of Canada with Dr. Taylor, and this is from 2022. It just gives us a snapshot of what's going on in Canada and who's participating in community water fluoridation. We will be updating this in 2027, which is coming around pretty quick. It always seems to come around quicker as you get older. So it just kind of shows that Ontario, Manitoba tend to be the higher provinces with populations that have access to fluoridated water. Whether they're going to drink it or not is another topic of conversation. Saskatchewan will be adding on Regina, possibly this year or early next year, and Calgary is scheduled to go on later this summer or early this fall. So those numbers will jump to probably over 60, 65%. So this is just for community water systems, the people who receive water from a water treatment plant. It doesn't include the estimates for coverage of wells because these naturally occurring fluoride levels are often unknown. So, you know, if you do have a well water system that you're on, and you can get that tested, because it can range. It can range anywhere in Canada to different parts per million of fluoride. So if you want to know that, for sure, get your water tested. Your well water tested, sorry. So, you know, water fluoridation is not the only way to get the benefits of fluoride. Millions of people living in Europe are receiving the benefits of fluoride as well. So it reaches over 13 million Europeans, mostly residents of Great Britain, Ireland, and Spain. I know there is also some fluoridated milk programs that in Eastern Europe. But salt fluoridation is most widely and reaches mostly used approach in Europe. And in fact, at least 70 million individuals consume fluoridated salt. And this method of fluoridation reaches most of the population in Germany, Switzerland, and I believe France as well. So some of those countries will have fluoridated salt and non-fluoridated salt on their shelves in the local grocery stores, and some will just have fluoridated salt at all only. Again, salt fluoridation is reaching more than 100 million in individuals or families in Mexico, Colombia, Peru, and Cuba. So generally, fluoridated salt is anywhere from 225 parts per million to up to 250 parts per million, which is a lot more than what is in water fluoridation. So they do give individuals a choice. And I happened to be in, was it Winkler or Steinbach? There's a Mexican store here in Manitoba. And I was perusing through the store with my kids last summer, and I found a package of fluoridated of salt. It was from Mexico, and it was fluoridated with 250 parts per million. So it is definitely available from your local specialty store. So again, another, why is, water fluoridation not wide, everywhere in Europe? And I mean, that's a decision made by those countries, but there's also technical challenges. In France and Switzerland, for example, water fluoridation is difficult to do because it's a terrain, a lot of mountainous hilly area, and because there may be tens of thousands separate sources of drinking water. So they're not like a lot of us on the flat prairies where it's flat land and you can, put in centralized systems that will supply, many communities. And so they do fault on Western Europe, more on salt fluoridation, fluoride rinse programs, and other means to get fluoride to the public. So just some little questions here that you just may have, won't be wondering about. So what are some sources of fluoride intake? So generally, 75% of a person's fluoride intake comes from drinking water. with added fluoride, and not just from fluoride, but from a combination of food and beverages such as soft drinks and fruit juices can be made with fluoridated water. So if you're getting um, something that's been manufactured, say in the GTA in Toronto, and they're using the local water source, Toronto fluoridates its water supply, so it's being incorporated into whatever beverages or foods that factory is making. While people swallow small amounts of fluoride from toothpaste and dental products as well, like mouth rinses, gels, and foams, we don't recommend that you swallow any of that. We recommend that you spit it out. Of course, we don't want you getting a stomach upset. And again, we talked about this previously that, kids think it's a good thing. So they want to swallow some, so you just gotta wipe it out, spit it out, and should be supervised during use. And that's why we also like to use fluoride varnish instead. Children may also take a doctor prescribed supplements that include fluoride, like a vitamin for the first 6 months, like tablets or drops. So here's another question too. Can I use fluoridated water to prepare infant formula? So yes, you can. Because most infant formulas contain low levels of fluoride, regularly mixed powdered or liquid infant formula with fluoridated water may increase the chance of a child developing the mild dental fluorosis. So, but you can use it if you if needed. And if your child, if you're only feeding your child infant formula mixed with fluoridated water, so you might have a chance for mild dental fluorosis, then you would use a low fluoride bottled water some of the time to mix infant formula. And these bottled waters would be labeled as deionized, purified, demineralized, or distilled, and without any fluoride after purification treatment. So fluoride is the last thing that's added after water goes through a water treatment plant. So you would look for any bottled water that's labeled as one of those four, and you'd be safe. And if you're only supplementing with infant formula, you'd probably be okay using fluoridated water some of the time. So what is the proper use of fluoridated toothpaste for children? If your child is under 3 years old, 0 to 36 months, you should consult a oral health professional or health professional to determine whether your child is at risk of developing tooth decay. If your child is at risk of developing tooth decay, then they should have their teeth brushed by an adult using a minimal amount of rice-sized grain of fluoridated toothpaste. You can always do the caries risk assessment tool to see what risk level they're at and determine whether you need to use the fluoridated toothpaste, but just a little smear is all you need. So age 3 to 6, adults should always help children under the age of 6 brush their teeth, and use only a small amount, small green pea-sized or 5 ml maximum of fluoridated toothpaste. There's a little green pea there. And once your child is 6 years old and has developed the ability to spit out the toothpaste, they are ready to start supervised brushing with using toothpaste that contains fluoride, or maybe that should say unsupervised. I think most kids need to be supervised up to a certain age anyways, brushing. My son on occasion would just wet his toothpaste when he was quite older than that. So yeah, they just need to be supervised. So, and this is one of the sheets that we produce, information sheets that we produce with Healthy Smile, Happy Child. There's a QR code down on the bottom there. Well, that will take you to a multitude of resources. This one is about toothpaste for young children. Yes, we do consider having a little bit of fluoride even when you're young, helpful for the young ones and their dentition. So again, this is just another slide about, can I use bottled water to mix baby formulas? Yes, you can use bottled water to reconstitute or mix powdered or liquid concentrate infant formulas, but be aware that the fluoride content in bottled water does vary. You need to read the labels. I've got some pictures coming up. If your child is exclusively consuming infant formula reconstituted with water that contains fluoride, again, we talked about the increased chance for mild dental fluorosis, which is not really visible to, the general eye. And to lessen this chance, again, you may choose to use low fluoride bottled water some of the time to mix infant formula. And again, just to drive this home, use those bottled waters that are labeled as deionized, purified, demineralized, or distilled, and are without any fluoride added after purification treatment. Is it safer to drink bottled water because it has no fluoride? Some companies promote their water based on the fact that it doesn't have any fluoride. Some bottled waters contain fluoride, some do not. It depends on the source waters, where it's coming from, or it can be added. Bottled water, if you're drinking that all the time and that's the only source that you're getting into your household, it may not have a sufficient amount of fluoride, which is important for preventing tooth decay and promoting oral health. Generally, though, a lot of kids are at school. They bring their own bottles and they're filling up at the source water at the school, and whatever that community is doing fluoridation wise, that's what the students and the children will be exposed to. So again, I'm going to show you some labels where to look on the water bottle, what the level of fluoride is. Again, water fluoride can be naturally present in the original source of the water. Okay, so here's an example. This is great water, great value. This, I'm guessing, is one of the major department stores brand. And down there in the bottle, circled in red, fluoride. So 0. So it doesn't have any fluoride in there. But they make it just small enough so that nobody can read it. And here's another one, Nestle Pure Life. So this one, fluoride is 0.4 parts per million. And this is a 1.5 liter bottle. So that's what it says on there, 1.5 liter bottle. So you really have to read the labels, especially if you're concerned about that and you're mixing up formula. Okay, so there's maybe a general thought going around now, depending on what you're reading or hearing about going on in the rest of North America. So fluoride doesn't belong in drinking water. It's already there. It exists naturally in virtually all water supplies and even in various brands of water, bottled water. If people making the statement truly believe they would no longer drink water or grape juice or eat shellfish, meat, cheese, or other foods that contain trace levels of fluoride. Also, what's being discussed is the amount of fluoride in water. There are proven benefits for public health that just come from having the optimal level of fluoride in water, just enough to protect our teeth. Drinking water guidelines recommend optimal level for water fluoridation at 0.7 parts per million. Toothpaste can be 1,200 to 1,500 parts per million. The high fluoride toothpaste can be up to 5,000 parts per million. Fluoride varnish, 20,000 parts per million. At 0.7 parts per million, we want to be able to tweak a local water supply so that it hits that, and that's our goal, is just getting enough to help us all of us keep our teeth a little bit longer, or a lot longer, not a little bit. Goodness gracious me, our teeth longer. So here are some of the references that I've used in the last 2 slides. The references, a lot of the references I used are from the ilikemyteeth.org and the American Association of Pediatrics Dentistry, and from the CDC. Right, their references are there. So thank you for attending. Presentation is over.